Welcome to week 7, where we move from the preparedness phases to response. So this week we're going to focus on your role as a public health professional in responding to an emergency. Remember that response requires you understand the PHEP organizational structure, policies, forms and procedures used, communication techniques, and appropriate and often immediate action needed. So it brings together all of the skills that you have learned throughout the course. So response can be broken down into several phases in an emergency. The first phase is the immediate, or 0 to 2 hours. The primary goal of this phase is assessing the situation. So as a public health professional, you would look at the situation to see whether or not, first of all, you even needed to be involved. What are the potential health impacts and exposure pathways? Have medical facilities been affected? Is there an incident command system set up? What other agencies are involved? And assuming you've decided that you indeed do have a role, you may need to contact key personnel, begin to follow an action plan, establish communications with the closest medical facilities, and begin risk communication activities. This phase is followed by the early intermediate phase, which is 2 to 6 hours. And here you continue on the immediate phase response activities as needed, but you also verify there are health surveillance systems, laboratories, and needed facilities that are operational nearby. You ensure that needs of special populations are being met. And this is more than just the populations we study. This includes medical patients with, say, dialysis equipment, for example, or transient and homeless populations. There's many special populations to consider. And you provide updated risk communication messages as needed. Then you move on to the late intermediate phase, which is 6 to 12 hours. And here you assess any surveillance health data results, prepare for shift changes, coordinate with any arriving state and federal agencies, continue to assess health and resource needs. And then we get to the extended phase, which is the last 12 to 24 hours of the first day. And here you begin to address mental health and behavioral health needs, prepare for transition to extended response aid and resources, continue with your communication messages, and maintain surveillance for post-hazard impacts. And then finally, there is a recovery phase, which occurs beyond the first day, and this is for recover and rebuild, which we'll discuss more next week. So your role as a public health professional during these phases varies with the specific incident. So during a biological incident or an infectious disease outbreak, for example, you might have a more active role in the immediate and intermediate phases, where with a flood, where there might be delayed byproducts of the event, your role may be more in the later phases. So for the logistics this week, what you're going to do in your readings is look at a case study review of the response to Hurricane Katrina and think as you read this how your actions might have differed at some stages of emergency preparedness and response based on what you've learned about public health emergency preparedness in this course. And then you'll practice what you learned in your assignment this week, where you can actually choose between 2 options. In option 1, you'll respond to an emergency as a public health professional in a simulated disaster. If you select this option, though, you must agree to participate and recognize that your responses will be used in research relating to the usefulness of simulations in educating and improving emergency response. But if you'd prefer not to participate in the simulation, option 2 allows you to alternatively write a case study report reviewing an emergency response to an actual disaster. So I hope you find this week integrates all you've learned and have a great week 7.